Dry eye disease affects millions of people and results in millions of dollars in lost production, and therefore is a major health issue in the United States. To truly attack this disease and be effective at treating it, you have to start with the evaluation and testing. Here at the Dry Eye Center of Northeastern Pennsylvania, we employ surveys, osmolarity tear testing, inflammatory tear testing, Schirmer scores, tear breakup analysis, lipiview, sodium fluorescein staining, Mibom expression, mibography, and lissamine corneal staining. We would encourage anyone interested in starting a dry eye clinic to utilize these techniques, but really you can get started using much less.
Of particular interest in the above-mentioned list of evaluation techniques for dry eye is Mibom expression and mibography. We find that this is a severely underutilized technique in correctly diagnosing, evaluating, and treating meibomian gland dysfunction and evaporative dry eye disease. All too often, practitioners will look at a patient and see a thickened erythematous lid margin with collarettes and diagnose blepharitis, and ask the patient to do a warm compress and lid scrubs twice a day. Unfortunately, we know that a large percentage of our patients will either incorrectly do this or not do it at all.
What we would like to do is express our patient's lid from the temporal to the nasal area and grade this expression as we're doing it. This gives us an idea on the extent of meibomian gland disease that is truly present. The next step is to photograph or video this to actually show the patient. Nothing is more impressive to the patient that there is a disease process taking place in their lids than to see the toothpaste-like secretion emanating from their lids.
Once this has been viewed by the patient, we will then take a transilluminator and place it under the lid of the patient and view the presence or atrophy of the meibomian glands in each section of the lids. Photographs are also taken of this for the patient to see. This is the most powerful photo to show the patient. We know that individuals are born with healthy, full meibomian glands and that their dysfunction over time will result in their atrophy. This is akin to glaucoma. If the disease is not treated and the presence of high pressure is not lowered, the optic nerve head will slowly die, and once it is gone, there is no way to bring it back. This is the way we need to start viewing meibomian gland dysfunction. We treat glaucoma because we know it is irreversible. We now know that meibomian gland dysfunction is as well.
With the increase in the aging population, we're seeing many more patients in their 70s, 80s, and even 90s. Unfortunately, many of these individuals have severe dry eye disease and meibomian gland disease from severe gland atrophy that was not treated years prior. We now have a successful, effective treatment to avoid meibomian gland disease, related gland atrophy that can avoid years of discomfort and millions of dollars in healthcare costs for many individuals in their elder years. This treatment is Mibo Thermoflo. The Mibo Thermoflo utilizes a constant flow of sustained heat and manual massage to empty the glands of the diseased meibum, creating a clean exit for newly created meibum and kickstarting the creation of new healthy meibum.
The way we explain it to patients is this. You have a disease condition going on. We show them the meibum coming out of their lids, and also the lack or presence of meibomian glands in their eyelids. If they have all or some of the glands remaining, we stress the importance of preventative care that the Mibo Thermoflo will provide to them. I like to liken it to regular dental hygiene appointments. Warm compresses at home are good, and they're like flossing your teeth, but you cannot replace brushing your teeth and flossing them with regular hygienist appointments, because they're able to clean your teeth much more effectively. Patients get this, and they get that if they do nothing, the condition gets worse. So many times we will have the patient try the warm compresses and lid scrubs and recheck the glands. If there is little to no change, then we know, and the patient knows, we need to do something more effective.